Hi, good afternoon, Mr. Scott. How are you doing?
Good, how are you?
I'm good. My name's Olivia. I'm going to be your nurse today. I'm just going to perform some hand hygiene real fast. Hey. So what brings you in today? The standard health assessment, comprehensive health assessment?
Yes, ma'am.
Great. Okay, well, let's just get started. I'm just going to have to ask you to verify your full name.
It's Colin Blair Scott.
Okay, great. And how old are you?
I'm 22 years old.
22 years old. Great. So do you have any complaints? Anything feel a little off today in your body?
I have some ankle pain, but it's
Ankle pain.
recovering.
Recovering? Can you describe your pain to me?
Just the pain surrounding a sprained ankle ligament damage from playing rugby.
Oh, gotcha. When did you get injured?
4 weeks ago.
4 weeks ago? Okay. And you said you're in recovery right now?
I believe so.
Okay, great. What do you do to help the pain go away?
Just initial ice, ibuprofen, and tape when I'm using it.
Great. Okay. Great. Could you rate it on a scale of 1 to 10?
I wouldn't say it's higher than a 3.
Okay, that's good. That's good to hear. Well, great. Are you currently taking any medications?
Not at the moment, no prescription medication.
No prescription medications. But do you take any pain medication like Advil?
Just ibuprofen.
Ibuprofen.
When needed.
Okay, when needed. Good to know. Do you know how much you take? Is it 200 milligrams?
Yeah.
Yeah, okay. Thank you. Do you take any sleep aids?
Melatonin, yeah.
Melatonin, okay. Do you know how many milligrams of that?
Usually 10.
10 milligrams, okay. Well, great. Do you have any allergies?
No, ma'am.
No? Okay. Making my job easy. All right, so we're going to move on to medical history. I have to ask you a quick question about your childhood diseases. Have you had any illnesses?
No.
None? Okay. What about adult injuries, diseases, illnesses?
No illnesses. One injury, another rugby-related injury,
Okay.
where I suffered a disc or an injury to my alignment in my right hip.
Your right hip.
Alignment and ligament damage.
Interesting. How long ago was that?
It'll be a year ago in the spring.
Wow. On a scale of 1 to 10, how would you rate that pain now?
Probably 5 to 7,
5
just
to
depending
7.
on the day.
Oh, wow. Are you doing anything to help your recovery? Like, do you see a chiropractor?
That's a chiropractor when needed,
When needed? Okay.
but more or less recovered over it.
Okay. Great. Have you had any head injuries? Any?
Yes, but not any confirmed concussions.
Okay. So how many would you say?
I'd say no more than 2.
2? Okay. And when did you get those?
The beginning of my rugby career, probably 2014, 2015.
Okay. Thank you. Have you had any surgeries?
No.
None? Okay. Do you have any psychiatric illnesses
No.
you've been diagnosed with? Okay. Great. All right. When was your last flu shot?
It'd be last year, I believe.
Last year? Okay. Great. Do you know about your tetanus shots, your MMR? You know if they're all up to date?
They are up to date, but I haven't had them since I was. Well, I got them when I was little.
Mm-hmm. But they are all up to date?
Yes.
Okay, great. Awesome. All right. Well, great. We're going to move on to family history. So are your mother and father still alive?
Yes.
Okay, great. And would you say they're relatively healthy right now? Are they?
Yes.
Okay, that's good. Do you have any siblings?
Yes.
You do. Brother or sister?
Younger sister.
Great. Does she have any diseases or illnesses?
No.
Okay, so we're going to move on to your social history. Do you have any hypertension, diabetes?
No.
No. Cardiac arrest? Have you ever experienced?
No.
No. What about a heart attack or coronary artery disease?
No.
No. Okay. What about tuberculosis?
No.
Okay. No. Any autoimmune diseases like lupus or
No.
HIV? No. Okay. Any renal diseases? Kidney? Okay. Or liver, I should say. Thyroid diseases? Hypothyroidism?
No.
Nothing? Okay. Any experience with depression? Have you?
No.
Okay. All right. What about any suicide attempts? Are you? Okay.
No.
Now we're going to get a little bit more personal. Do you have a history of alcoholism in your family?
In my family, yes.
Yes. Do you struggle yourself with it?
No.
No. Okay. What about substance abuse? Do you use any? Okay. All right. What about any other diseases like cancer or?
There's a history of cancer
History
in
of
my
cancer.
family, but I don't know the details
Yeah.
on it off the top of my head.
All right, so Mr. Scott, where were you born?
Mesa, Arizona.
Mesa, Arizona. What brings you out to Arkansas?
School?
School? Very cool. Great. So education, are you still in school right now, or are you?
Yes, I'll be graduating with a bachelor's degree in December.
Oh, that's exciting. Are you ready to be done?
Yes.
Yes, yeah. It's funny. What's your bachelor's in?
Family and Human Services.
Very cool. All right. So we're going to talk a little bit about your family situation. You mentioned you had your mother and your father and your sister. Do y'all live together when you go home?
My sister's moved out, but yes, until I come back after the new year, I'll be staying with them.
Okay. Would you say you have a pretty healthy relationship with them?
I would.
Pardon?
I said I would.
Great. What about interests and hobbies? Do you have any hobbies you like?
Yeah, I would just say weight training, nutrition, and just athletics.
Athletics. Okay. And I know you mentioned rugby. Are you still
Yes.
active in there? Okay. Very cool. Great. All right, so we're just going to move on to general symptoms that you've been experiencing or not. All right, so I'm just going to list through each one and just tell me if you've been experiencing them. So have you noticed any weight changes, any weakness, fatigue, fevers?
No.
No? Okay. What about your skin? Do you have any rashes or lumps or sores I should know about?
No.
Okay. What about headaches, dizziness?
Some headaches.
Some headaches? Okay.
No dizziness.
Can you describe the headache to me? Does it feel like a tight band around your head, or what does it feel like?
It's more behind my eyes and in my forehead.
Okay. Okay. And do you wear corrective lenses?
Yes.
You do? Okay. When was your last eye exam? Do you know?
This past summer.
Past summer? Okay. Do you struggle with any excessive tearing, double vision, blurred vision?
No.
No? Okay. Okay. Have you noticed any hearing changes?
No.
Like ringing in your ears or harder to hear things? No? Okay. All right, so have you had any colds recently, or I should say now, are you experiencing any symptoms of a cold, like runny nose or
No.
coughing? No? Okay. Great. All right, when was your last dental exam? Do you know?
This past summer.
This past summer? Okay. Did you find anything out there? Are there any bleeding gums, cavities?
No.
Sores? No. Okay. Great. Right. And what about in your neck? Does it feel stiff at all? Or are there any? Does it feel swollen around your throat area or
No.
over here? No. Okay. All right. Let's see. When you cough, have you coughed up anything? Any like mucus or no? Okay. Great. Any chest pain or discomfort? Palpitations? Nothing? Okay. All right. Have you noticed any appetite changes? Or what about your bowel elimination? Is it fairly regular?
Yeah.
Any differences?
No.
In it? Okay. Great. Let's see. What about urination? Have you noticed any change in the color or the frequency of when you go? Okay. All right, we're almost done here. Thank you, Mr. Scott.
All right.
Let's see. So, Mr. Scott, are you sexually active at all?
No.
No? Okay. Let's see. Do you have any leg cramps or varicose veins, a history of blood clots?
No.
No? Okay. Let's see. Have you had any muscle or joint pain or stiffness in your joints at all?
No, nothing worth reporting.
Okay. Have you had any seizures or weakness or partial paralysis? Have you just lost movement at all? Okay. Do you have a history of anemia or easy bruising or bleeding?
No.
No? Okay. Okay, so have you noticed any heat or cold intolerance? Have you been sweating more?
No heat and cold intolerance, but I have been sweating more.
Can you tell me why or when that started?
I don't know why it started, but I feel like it's began when I started intensively weight training.
Okay,
Probably 3 or 4 years ago.
gotcha. All right, great. Have you noticed any nervousness or anxiety, depression, memory changes?
No.
Nothing? Okay. Well, great. Now we'll start the physical exam part of this segment, so I'll just... Okay, Mr. Scott, before I continue, I have to ask if you're feeling any pain right now. And if you could rate it on a scale of 1 to 10.
Not particularly, no.
No pain? So you would say a 0 out of 10? Okay,
I'd say so.
great. Thank you. All right, Mr. Scott, I'm just going to take your blood pressure really fast.
Alright.
Do you have a preference of which arm I should use?
Could probably use this one, because it's closer.
Okay, well, thanks. Thank you for clarifying.
Yeah.
All right. Let me know if this is too tight at all. Okay. Is that light? Too tight?
That's fine.
Okay. Okay, great. Right, 110/63. Does that sound fairly normal to you?
I guess.
Okay. Okay, great. Okay. And now I'm going to take your radial pulse. So can I have this wrist from you? Okay. Okay. 68 beats per minute. Okay, Mr. Scott, now I'm going to take your temperature. Okay?
Okay.
So how are you feeling today?
I'm good today. I'm just a little hungry.
A little hungry? Okay. I'll get you out of here real fast so you can go eat.
Alright, sounds good.
Ready? All right, 98.0. That's good. So, Mr. Scott, can you tell me where you are?
I'm in the nursing building, John Brown University.
All right, can you state your full name?
Colin Blair Scott,
Colin Blair Scott, and do you know what year it is?
2016.
Great. All right. Very good. So he's oriented to the time, the place, and the year. Great. Okay, Mr. Scott, I just want to confirm that your weight is 197 pounds, and you listed that you were 5'11". Is that correct?
Yes, ma'am.
Okay, Scott, now I'm going to listen to your lung sound. So before I begin, do you have any tenderness on your chest or your back that I should be aware of?
No, ma'am.
Any open lesions on the front or the back?
No.
Nope. Any shortness of breath at all?
No.
Okay, great. All right, so I'm going to start with listening to your lungs and your back, okay? So if you would take deep breaths in and out for me, that would be great.
All right.
Okay, in, out, in, out, in, out, in, 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 out, in, out, in, out, in. Okay, so I'm going to take a listen to the front as well, okay?
Alright.
Deep breath in. Out. And in. Out. In. And out. In. And out. In. Out. In. Out. In. Out. In. Out. Okay, so Mr. Scott's lung sound clear bilaterally, posteriorly and anteriorly. And I noted his heart sounds as well. He has S1 and S2 noted, but no S3, S4, any murmurs noted as well. While assessing Colin's lung sounds, I found no wheezing, ronchi, adventitious, or diminished sounds with auscultation bilaterally. For this portion of the video, I'm going to inspect Colin's skin on his chest. So is it okay if I look down here for a little bit?
Mhm.
As far as I can see, his skin is very smooth. There's no lesions noted, and there's no lumps or anything that I could see. Let's see. And now I'm going to palpate. So I'm going to feel around to see if I can feel any lumps at all. Can you raise your arm up for me? Does that hurt?
No.
Does it tickle?
Yeah.
Does that hurt?
No.
Okay. All right, lower this arm for me. Raise this one. Any tenderness?
No.
Okay. So I feel no lumps or any bumps that are out of place. For this portion of the video, I'm going to assess his head and his face. So Mr. Scott, can you take your hat off for me? Great. And as I can see right now, he has no dandruff, his hair is smooth, there's no patchiness at all, and yes, no signs of parasites or any type of fleas or anything in there. Let's see. His cranium is symmetrical. There are no bumps that I can see. Great. All right, Mr. Scott, can you smile for me? Great. Can you raise your eyebrows? All right, can you close your eyes and then open them again? Great. Okay, so his cranial nerve, number 7, is intact. He's able to smile and open and close his eyes. Can you repeat after me? BMW.
BMW.
Great. And he's able to produce labial speech. All right, Mr. Scott, can you open your jaw for me? Can you move it side to side? Great. So I felt no popping or any type of dislocation or tenderness. Let's see. His temporal pulse is palpable, with no swelling or tenderness noted. Okay, Mr. Scott, I'm going to look at your sinuses, so I'm just going to press down right here. His maxillary sinuses are not tender or swollen at all, and I'm going to press down here as well. His frontal sinuses are not tender or swollen at all. For this portion of the video, I'm going to assess Colin's visual field. So by having him stand 20 feet away, I'm going to assess how each of his eyes can read the chart successfully. Okay, Colin, so I'm going to ask you to cover one eye. Doesn't matter which eye. There you go. And can you read the first line?
E.
Second.
F. P.
Third.
T. O. Z.
Fourth.
L. P. E. D.
Fifth.
P. E. C. F. D.
Sixth.
E. D. F. C. Z. P.
Seventh.
F. E. L. O. P. Z. D.
Eighth.
D. E. F. P. O. T. E. C.
Ninth.
L. E. F. O. D. P. C. T.
And 10th.
F. D. P. L. T. C. E. O.
Great. And 11th.
Not really.
That's okay. Well, and that would be his right eye. So in his right eye, he would be considered to have 20/13 vision with corrective lenses. So can you switch to the other eye? Great. First line.
E.
Second.
F. P.
Third.
T. O. Z.
Fourth.
L. P. E. D.
Fifth.
P. E. C. F. D.
Sixth.
E. D. F. C. Z. P.
And seventh.
F. E. L. O. P. Z. D.
Eighth.
D. E. F. P. O. T. E. C.
Ninth.
L. E. F. O. T. P. C. T.
And 10th.
F. D. P. L. T. C. E. O.
Great. And 11th.
No.
No. Okay. So in both eyes, I would say that he has 20/13 vision with corrective lenses bilaterally. So Colin's last eye exam was noted to be over the summer, but I'm going to assess his cranial nerves 3, 4, and 6. Okay. So Colin, can you follow my pen light? This way, up and down, and towards your nose. Can you do that again? Can you cross your eyes? Okay. Well, I see no involuntary eye movements, and let me see. I'm going to assess your eye pupils. Right, ready? Shine a light in one eye. Okay, great. And can you look at me and then look at the back wall? Okay. Okay. So I assessed Perla, and he seems to be, his pupils are reactive to light, they are round, and he is able to demonstrate proper movement of his eyes with the cardinal positions of gaze. All right, and as I'm looking at his eyelids and eyelashes, I see no abnormalities noted. As I'm looking at his inside of his eyes, they are pink and moist. There's no swelling, his sclera are white. There's no yellow color. And his corneas, can I see your eyes again? Are intact with no swelling. Great. Okay, so Colin, are you familiar with what an ophthalmoscope is?
No, ma'am.
Okay, well, it's similar to the otoscope except for your eyes. So it's basically an instrument that we use that shines a light into your eyes that we are able to view your lens and pretty much see the inside of your eyeball and the internal structures of your eye. Pretty cool.
Very cool.
Great. I'm going to assess Colin's ears. So I'm going to palpate around his ears. I feel no swelling or edema. Does this hurt at all? Is it tender?
No.
No. Okay, great. And as I'm looking right now, I see no lesions. I see no swelling at all. Okay. And yeah, I did it bilaterally, so it's okay. So Mr. Scott, are you familiar with what an otoscope is?
No, I'm not.
Okay, well let me tell you about it. An otoscope is an instrument that pretty much projects light into your ear so I can observe the structures of your ear and your ear canal so I can see if anything funky is going on. Okay?
Okay.
Great. That's all. Now I'm going to assess Colin's cranial nerve 2. Okay, so Colin, I'm going to whisper 2 words into your ear and I'm going to ask you to say them back to me, okay?
Okay.
Right? Summer friends.
Summer friends.
Winter.
Winter rugby.
Okay. So Colin is able to hear. So Mr. Scott, are you familiar with what the Weber and Rhine tests are?
No, I'm not.
Okay, so the Weber and Rhine tests, it uses the tuning fork to detect hearing strength and loss through air conduction and bone conduction by striking the fork. And it creates vibrational sound that could be heard with ear structures. So now I'm going to assess Colin's nose. And as I can see right now, it's symmetrical in structure, and the septum is midline. Let's see, there's no excessive drainage, tenderness, or swelling nose, but he has a little bit of postnasal drip due to allergies, and it's a clear color. Let's see. Mr. Scott, I'm going to ask you to cover one nostril and breathe through the other one. Can you do that?
Doesn't matter which one.
We're going to do both, so let's start with one. Other one? Great. Okay, so he's demonstrated patency to each nostril by breathing by covering the other nostril. All right, at this part of the movie, I'm going to take a look at Colin's mouth. So, Colin, can you open your mouth for me? All right. I'm going to look at your gums, and I can see that they're pink and they're moist, and there's no swelling at all or discoloration or bumps. All teeth are present. Can you keep it open for me? Yep, all of them are present. And I do not see any cavities as well. And this makes sense because the last exam he took was over the summer. There's no bleeding, and can you open again? The tongue is symmetrical and there are no bumps. It is pink and it is moist as well. And there's no lesions or discoloration noted. I'm going to take a look at your tonsils again, so I'm going to ask you to open up. Can you stick your tongue out for me too and say ah?
Ah.
Great. Okay, so there's no swelling in his tonsils or discoloration noted. All right, can you stick your tongue out for me? Lower your head a little bit. And can you go ah?
Ah.
All right, so his uvula is pink and yeah, and it's moist and there's no discoloration as well. And yeah, it rises and falls with the voice, and it is symmetrical. And okay, can you stick your tongue out for me? Like this. Can you move it side to side? Okay, great. He is able to stick his tongue straight out, and can you lift it upward? Towards the ceiling? Yes, he is able to lift it upward, and it is pink and moist, and no discoloration noted. Now I'm going to assess Colin's neck, so I'm going to palpate around his neck. Is there any tenderness? There's no swelling noted, and there's no red or inflammation noted as well. I could feel his lymph nodes, but they are not protruding or swollen at all, or tenderness, as he said before. And now I'm going to take his carotid pulse. So, I'm going to put it right here. Okay, I can feel it. It's strong, and it's a 2+ pulse palpated, and there's no bruits noted bilaterally as well. His trachea is located as midline, and His thyroid gland is smooth and non-nodular. Colin, I'm going to look at your jugular vein, so can you tilt your head to the side for me? Great. Raise it back up. Okay, so as I can see, the JVD is not distended at all, and when palpating, it was not sensitive. Let's see. Does that hurt at all? Bilaterally. For this portion of the video, I'm going to assess Colin's heart sounds in more detail. Okay? Okay, so his apical pulse would be 72 beats per minute, and I could hear no pulsations or any heave when I was assessing that. Okay, and his apical pulse is clearly and easily auscultated. As soon as I put my stethoscope on, I can hear it. And it was auscultated at the 5th ICS mid-clavicular line. Let's see, I'm going to take another listen. Okay, so Colin's respirations were 16 beats per minute, and also while I was listening, there were no thrills detected with assessment and palpation. Okay? And as I mentioned before, his heart sounds S and 1 were audible with auscultation, and I heard no S3 or S4 or murmur. For this portion of the video, I am going to ask Colin to lay down so I can assess his abdomen, as he already has done. So, great. So before I begin, I want to inspect his abdomen to see if there's any lesions or distension or any type of non-symmetrical things going down. So can you put both of your arms down at your side? Okay. So as I can see, it is symmetrical, and there's no bulges or masses or distension that I could see. Okay, now I'm going to palpate. So I'm just going to feel around to see if there's anything tender. Does this hurt at all? Any tenderness?
No.
Okay, now I'm going to press a little deeper. Does that hurt at all?
Nope.
Nope. There?
No.
What about down here? No. Okay. So in all 4 quadrants, there is no tenderness noted. And at this point, I'm going to listen to his vowel sounds. So. So in all 4 quadrants, I could hear very hyperactive vowel sounds. So that would be very active. And while I was there, I heard no bruits or no thrills, along with while I was palpating. There's no tenderness, as I said before, or lumps or masses that I could feel. Can you shrug your shoulders for me? To your ears? Did that hurt at all?
No.
Okay. All right. Can you stick your head down like this? Can you move it back up? turn it side to the other side. Did that hurt at all?
No.
Okay, great. So his cranial nerve 11 is intact. Okay, so now I'm going to assess Colin's epitrochlear node. So can you raise your arms up like this for me? Okay. Does that tickle?
Mm-hmm.
Okay, so there's no tenderness or swelling noted. Let me check this arm as well. Is that tender at all?
No.
Okay. Bilaterally, so with palpation. So Colin, are you familiar with how a breast exam goes?
Can't say that I am.
Okay, well I'm just going to explain it to you. So what I would have you do if I was assessing this, you would lie down on your back and you would raise both of your arms up like this above your head, and then starting with your axillary tail area, so that's pretty much near your armpit, I would palpate and I would move down in a straight line upward and downward across the breast tissue. And then I would palpate around the nipple and the areola to see if there's any tenderness or if there's any lumps that I could find. Yes, that's all. Very good. And can you touch the back of your head with both of your arms like this, your hands? Okay, good. Does that cause any pain at all?
No.
Nope. Can you touch the small of your back? Very good. Great. For this portion of the video, I'm going to assess Colin's lower extremities. So before we begin, I'm going to ask him to take his shoes off. So Colin, can you take your shoes off? Oh, I see you already have. And as I can see right here, his skin looks very pink. It's very smooth and warm. There's no coolness at all, and it's very moist. There's no lesions that I can see. And let's see. I see no bunions or any type of corns on his feet as well. Okay, so now I'm going to assess your pedal pulse. So I'm going to come down here and take your pulse in your feet. Okay. He has a very strong and regular pedal pulse, and I could feel it bilaterally as soon as I even put my fingers on it. So I would consider that a palpable 2+ pulse present to the pedal pulse. And then I'm going to take your posterior tibial. That is very strong as well, bilaterally. And now I'm going to assess your dorsalis popliteal, as well. So. Okay, great. So for all of the pulses that I assessed, I could see bilaterally that they were very strong, and I could feel them as soon as I even palpated. Okay, great. So as I'm looking at the toes right now, there's a little bit of dryness to the bottom of the toes, but there's no lumps or lesions noted. And now I'm going to take your cap refill. His cap refill was very quick. It was less than 2 seconds. And there's no tenderness at all. So now I'm going to assess Colin's range of motion and muscular strength in his feet. So Colin, can you move both of your ankles in a circle? Does that cause any pain? No?
No.
Okay, other way? None?
No.
Okay, can you write your name with both of your feet? There's no discomfort with that at all?
No.
Okay. All right, so flex your feet for me. All right, push down as hard as you can. Great, okay. So he has very strong range of motion in his feet, and good muscle strength demonstrated with resistance. Okay? All right, so now I'm going to pinch your feet, and can you tell me if that hurts at all?
Yes.
Okay. So he's able to decipher sharp pain. Can you feel this?
Yes.
Very soft, right? Okay. As well as soft. Great. Okay. And at this portion, can you close your eyes? And can you stick your arms out to the side? Now, can you touch your nose with your fingers? All right, now one at a time. Okay, arms back out. One hand at a time. Yes. Then back out. Okay, great. So his cerebral function from his finger to nose, he is able to successfully touch his nose. And now I'm going to assess his Babinski reflex. So Colin, can you flex your feet for me? Okay, so that would be a negative sign for his Babinski reflex. For this portion of the video, I'm going to assess Colin's musculoskeletal function. Okay, Colin, so I'm going to ask you to walk like this across the room, heel to toe. Can you demonstrate that for me? As I can see right now, Colin is able to successfully walk across the room, heel to toe, with no disbalance or any type of unbalance. Okay, walk back. All right, so for this portion, can you stop? I'm going to ask you to walk on your toes and walk on your heels. So at first, I'm going to ask you to walk on your tiptoes. Can you do that for me? Does that cause any discomfort? All right, now on your heels. Any discomfort? None at all?
Nope.
Okay, great. Great. So for this portion, let's see, Colin, stay in one place. For this portion of the video, I'm going to assess Colin's Romberg sign. So Colin, would you close your eyes for me? Okay, great. Now can you stay there for 10 seconds? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So now I'm going to push Colin slightly. Close your eyes again. And he swayed slightly, but he did not fall down, which is good. He's able to compensate his balance when he was pushed slightly. Okay, you can open your eyes now. Great. For this portion of the video, I'm going to inspect Colin's spine. So Colin, can you bend over like this, as far as you can? All right. And while looking at his spine, I can see that there's no non-symmetry, that it is symmetrical, and there's no lumps or any type of imbalance in his spine. And as I can feel it, I feel no curvatures, I feel nothing out of place. Okay, can you bend back up for me? Okay, now can you sway to the side? Twist your body like this. Now the other way. And he has good range of motion in his spine as well.